Okay, let's get started now. We are live now on YouTube and also live right now at the same time in Zoom classes.
Okay,
So
let's
good
get
morning.
started now. We are live now on YouTube
Give me 1 second. Some
and
voices are
also
coming
live
in
right now
between.
at the same time in Zoom class.
Okay, now I think it's gonna be fine. Okay, so good morning once again and good evening, some of you. So this is Kaps here from the Kaps Nursing Classes. Those who are attending very first time on my platform, just so you know, right now my local time is almost 11:10 in the night time, and I'm joining from Canada at this time from Alberta. So this is the night time right now in my location. So good evening, some of you, and good morning definitely at the same time. Now, in today's class, what we are going to discuss is this is the day one for the practice session. So we are going to bring some live practice questions for next 10 days, right? And I think this is very, very important because majority of the students, I think in my experience, since I'm teaching for the NCLEX, what I have seen is they do have a knowledge, but then they don't know how to apply that knowledge into the questions, right? So that is a little bit problem. So that makes me feel I think everybody should need to know some good strategies, how to handle the questions. And especially I have seen the students, they get scared from the pharmacology questions, right? So the very first lecture I thought to bring today on the pharmacology, and we are going to practice some live questions together using some strategies, right? Now, before I begin anything about for this class, the one thing I want to say is some students who regularly attend my classes, they know already, but some maybe they are joining very first time here. So just so you know, if in case I leave the room for 5-10 minutes, so just cooperate with me a little bit because I have a little baby who is sleeping in the next room right now. So just in case my baby gets awake or start crying, I might need to leave the room for few minutes, maybe about for 5 to 10 minutes, but I'll come back here again. Okay, so just stay connected with me. This class is going to be for an hour to 2 hours. Depends how much discussion we have here today related to the questions, right? Now, let's get started without wasting the time. I can also see the YouTube at the same time. I can also see the questions at the same time from the Zoom. So anytime in the class, if you have any doubts, any questions, feel free to type for me so I can always address the questions for you. Okay? Now, why do we need to know the strategies? Why do we need to know the strategies, right? I personally think the strategies meaning is basically, as I said, lot of times students they do have a knowledge because everybody graduated from nursing. They know about the knowledge part, right? But I think we should have something like that, is there any way to do the questions which we can do the question with the less knowledge or maybe with the no knowledge, so sometimes I have seen the bouncer questions, and I think the repeat test takers they can correlate here with me from the NCLEX. You will be seeing a lot, those medications in the exam which you never heard before, and you will be like how to handle those questions, right? So my goal for today's class is definitely to bring as much as I can, those type of questions in front of you. So you feel more confident, how to apply the strategies in there, like the ways, the techniques to do those questions, right? With the less knowledge or maybe no knowledge about those medication. You never heard about them maybe before, right? So this is my main goal for today's class in the first session, right? Now, the next thing I want to talk about here is in the next slide is about the calendar before I begin anything about the today's class, right? This is the calendar I have already posted in majority of the platform. Like you can see what we are going to discuss for the next 10 days. And I think we should learn in this manner the way the NCLEX they're asking you the questions and the way every student they feel struggle, for example, pharmacology, a lot of huge amount of questions in your exam upon on the pharmacology. SATA question, select all that apply. A lot of students they get scared when they see the SATA question, how to handle those type of questions. We also going to discuss in 2 days some new engine style questions, some case studies as well. So you feel the master in those questions. Any question come in front of you, after attending these classes, you are like, I know how to handle the case studies now. I know how to handle these SATA or pharmacology or these type of questions, right? Even though I'm also going to bring these some priority questions too. Everything seems nice when you see the question. You are like, what comes first, right? Because you might heard ABC a lot or maybe nursing process a lot before, but still you don't know how to apply into the questions, right? So that thing we're going to bring on the day 6 as well. So stay connect with me. I will come online probably this time every day, but I always message in the WhatsApp group before around to give you an idea when I'm going to come online. Now, the teaching based questions are also huge amount of weightage in the examination recently. So a lot of students, they still need to know how to handle the teaching based questions as well. And they're usually select all that apply questions as well. So which we're going to discuss on day 7. We also going to talk about the prioritization questions too. When you have 4 different patients in front of you, and you still don't know which patient going to die first, how to pick the answer. So we're going to talk about that on day 8. Some questions related to follow up, what order to clarify with the physician, which things you want to follow up in the 4 different options. We're going to master those things on day 9. And the day 10, we're going to talk about the immediately. Whenever you see a question, the word says immediately, how to handle that type of question. We're going to master them definitely on day 10. Now, definitely, this is the idea for your calendar. So you really should know, is it like something going to be benefiting for you for next 10 days or not? Do you really need those sessions, right? So this is something going to give you an idea a lot, right? And I'm pretty sure a lot of students who especially went already for the NCLEX exam, they know these are the heavy weightage in your exam, and this is where they're struggling for sure. Even though some students, they are the first time test taker, I have received lots of calls every day, messages like, in your software, I'm not getting scores online, where I'm facing problem, I don't know how to improve my scores when I'm doing the questions, right? So that makes me bring these kind of session for all of you, so it can help you as well. And definitely these NCLEX related questions or the videos, the strategies, it's also going to help you if you're writing the different exam like NORCET or any other nursing competitive exams too. So this will help you for sure. Now, let's talk about some methods first before we look the questions today, right? Now, this is something very simple methods, which I usually use it. I personally think for pharmacology questions, everybody should know, pick that answer which is more practically possible, right? Something practically possible in real life. This is how I pick the answer there. You will see with me today. And also some common sense, sometimes I notice like some common sense answers are very there. Even some non-nursing background students, they can easily answer and pick the questions in there easily. So I personally think common sense is also very important at the same time when you pick the answer. And the last one I have noticed that like, sometime when you get stuck in the question, I look for a clue, in the question sometime, and what kind of clue I usually look for? I try to see if the NCLEX give me already why they are giving me that drug. Like any particular name of the diagnosed condition is there, why they are giving that drug, or maybe a symptom is given in the question, right? So I usually try these different methods, whenever I'm doing any questions in there, this is the method I'm using. Now, I can see students are joining from India, Pakistan, Nigeria at this time. Yeah. Pretty much. I can see a lot of messages is in here. Well, thanks so much for coming around from all over the world. I know from US as well, some students are in there in this program at this time, and some YouTube students are also live right now from different part of the world. What I want to say, nurses, doesn't matter, are you a nursing student or you graduated? Are you writing the NCLEX now, later? Maybe you're a repeat test taker, first time, doesn't matter. I can guarantee you these methods will help you a lot to find out the answer after the today's class. So make sure you watch the videos until the very end. If something does not work out best with you, maybe you still don't understand how to apply that particular strategy, feel free to always connect with me on the WhatsApp, right? So I can always give you a different strategy because I think I have more than 500 maybe strategies with me, but in 10 days, probably I'm going to bring the strategies with you, about 50 strategies in 10 days, close to 50 or more than 50. This is what I can say. And these strategies, I can guarantee you the one I'm bringing it, you're not going to find anywhere on the Google, everyone, because this is my own creation from teaching from many years for the nursing students for the NCLEX. Especially I'm teaching all the international graduated nurses around the world. So this is like a trial I have seen in my program that it works with everyone. But if it doesn't work with anyone, you let me know, feel welcome. So I can always tell you a different style, how to look into the question and how to find out the answer. Now, let's see the first question here on the screen with me. You can also try your best to participate at the same time. Try your best to participate and find out the answer with me. Maybe something you want to try, wrong answer, right answer, doesn't matter. Try your best, but I will also tell you how I look into this question at the same time. So if I'm a student and writing this test and I'm looking this first question on my screen, how I would be reading this question. What I will do is I will just say here, the nurse is preparing to administer this medicine, eye drops. I'm not going to use the word timolol, letanopros. Why I'm not going to say those words as a student in my brain? Because when you say these difficult language terms, sometimes it's a wastage of time, believe me, right? Because sometimes you get so busy in pronouncing them. So first of all, just simply tell your brain to administer this medicine and this medicine. That's it, right? Because it's still the medication name at the end of the day. And then you have eye drop, basically this one for a client with glaucoma. Maybe you already know what is glaucoma. Maybe you don't know what is glaucoma. That's okay. Still see how to solve this question with me. So if I have two different meds like this, and it's like eye drops, they said, I will try to find out this answer. They said, what would you do? Which action should the nurse take first? So if I'm the nurse here, what I'm gonna do, what I'm gonna take in here. Now, this is something regarding eye drops I can see here. So I will just try my best to apply the common sense, right? Probably, maybe I will also try to find out something which is good idea, something which is bad idea to apply into the questions, right? So the first one I can see here is wait 1 minute between installation of the different medicated drops. I will ask myself as a student, why I have to wait 1 minute? Why it doesn't say 30 seconds, 10 seconds, 2 minutes, 5 minutes, This is like a question to my brain. When I do this question as a student in the exam, imagine, right? If I'm in your place right now, I would be like, why they say just the 1 minute, right? So this is kind of like a question mark for my brain. Then, if you're not sure about this question, this point yet, then compare with the number 2. Now, when I compare with the number 2, it says apply gentle pressure on the nasolacrimal duct after the administration. I think every nurse knows this one, like after any single eye drop, whichever you are administering, right? You still have to apply the gentle pressure in there, right? So I would be like, this is a good idea. I know this is a good idea for sure, but I don't know about the first one yet, right? Something which I already know, I'll keep it in. Something which I don't know, I will take it out. Why? because I only have to pick one answer in here. I cannot pick both together, right? Now, when you compare between 2 and 3, the 3 says instruct the client to avoid blinking. Use common sense here. Ask yourself, if you are the patient here, can you stay without blinking for 30 seconds, right? Is it practically possible for every single patient in the world, right? This is something you want to ask yourself, right? Why the patient has to avoid the blinking for a particular amount of period of time, right? This is something I'm like not practically making sense to me. Now you go between 2 and 4. The force is instill drops by inverting the vial, and then you hold it vertically over the cornea, right? First of all, look at the language. You're putting the drops here, inverting the vial. So imagine if I have a vial like this with me. First, I have to make like inverted, downward like this. And then they said hold it vertically. Again, hold it vertically like again. Doesn't make me any sense again over the cornea. I think the 2 is still the better answer, which I know as a nurse. Something which is 4 not even practically sounds good to me. I will not gonna go with that. So for me, the right answer is number 2. Even if I don't know what is timolol, even if I don't know what is latanoprost, whatever does it say, right? Even some students, they don't know what is glaucoma yet, right? This is how I will look into this question as a strategy wise. Now, I want to say one thing to all the students here. If you do have a good knowledge about the meds, the meds, these diagnosed already before, you want to apply the knowledge part, maybe go for it, right? Remember, the strategies means work in those cases when you do not have a knowledge about it, right? So only apply these things in there when you are totally blank into that question, right? So you really want to use the common sense, something good idea, something bad idea, elimination process, and then just find out the answer, right? Now, the second is the right answer for this question. I don't see much participation here yet. Please feel free to use your chat boxes at the same time. So I know which answer do you think also at the same time as well. Try your best to type in the chat box, Zoom students, and the YouTube students can also type in the live chat at the same time. So I know if you're choosing the right answer or you're choosing a different answer in there, right? I can see someone picked the answer number 1. So when you pick the answer number 1, Umar, do you think it is practically possible? Why you want to wait just for 1 minute? Why not 2 minutes? Why not 5 minutes? This is my question back to you. Why not 30 seconds, right? So this is something you want to think about it, right? Now, let's see the next question here and see how you handle this type of question also, right? The question is, the nurse is teaching a client with a UTI who is receiving, and it's a newly prescribed medication, they give you a name, right? Now, what is what's going to happen in the real exam? A lot of students, what they do is when they see a med name, they start thinking about the knowledge part. Oh my God, I did not read about this medication into the book, right? Where did I read about this medication? In which chapter, which unit, So I highly, highly recommend it in the real exam. Try your best to stay confident and remind yourself you are the nurse, you are the RN, you're the LPN there, depending which exam you're writing down or you're solving this question for different nursing exam too. Just remind yourself you are the nurse and you can get it, right? So read the option first, use elimination process, see if you can find out the answer still, right? Now, I don't know about this medication yet still, what it is, right? But you got a clue sometimes. They give you the word here, UTI, right? But if you don't want to look at that still as well, let's see how to handle this question. It says, which of the following statement by the client would indicate the correct understanding of the teaching? That means I have to look into the right statement, not the wrong statement here, right? Like, how do I know if a patient has a new medication here and the patient understand everything about the new medication here? This is something I need to find out with the common sense, right? Now, the first one says, taking this medication will make urinating less painful. I don't know if this is possible or not, right? But you know what? It sounds like when the patient say this thing, sounds like patient know why the patient is taking this medication, maybe for a symptom, right? So hold on for now until you compare with something. And then you compare between 1 and 2 now. The 2 says, I will call my doctor right away if I experience changing in the urine color. Right away? Is this the medical emergency that the patient has to call the right away if there is a changing in the urine color? This is how I will think. I think I can tell my patient, yeah, you can definitely report to the doctor, but that something can wait, not something right away. You have to pick up the phone and call the right away. This is how I will think about this language. So still up, I'll pick the option number 1. I'll delete the option number 2. Now you go between 1 and 3. The 3 says, I will need to continue taking this medication even if my symptom improve. Okay, how the patient can decide this? I think I need to, tell the patient um, it's better to talk with the doctor about it. Once your symptoms get improved, discuss with the physician about it, see if you still need to take it or if you don't need to take this medication anymore. Right? So I don't think so. This is the right answer here again. Now you compare between 1 and 4, right? The 4 says medication works by killing the bacteria that causes the UTI, right? Now, if you are my patient here, imagine you all are my patient here in this question, not the nurses now. Imagine if you are the patient here and you are taking a medication right now in your mouth, right? So, do you think for you it's important to say why are you taking that medication because of a symptom you want to improve or something? Or do you think as a patient you will describe me it's going to kill your bacteria and so, right? This is how you will think about it. Which language is more easy for a patient perspective and which is more practically something, the patient can say it, right? This is how you will think about for this question, right? I can see some answers here so far. 2, 1, 3, 2, 1, 3, 1, 2, 2 is the right answer. 1. Okay, so this is not the Francis. The when you say 1 is wrong because the nurse cannot guarantee the less pain. So remember, this statement is mentioned by the patient, by the client, not by the nurse. So you're not saying that your pain is gonna be less painful. It's a patient is saying that, right? Like the patient is telling you, okay, if I take this medication, it will help with my headache. If I take this medication, it will help with my pain. This is how the patient is describing you in this question. Now, let's try your best, everyone. I'm still waiting for the right answer here. Okay. Okay. Perfect. I can see one person pick the right answer, which is Presi. And Farzana picked the right answer as well. Gurpinder picked the right answer. Manpreet, Shakuntala picked the right answer too. Very good, very good, very good. 1 is the right answer in this question, not the number 4. Why? Let me give you a different example. Imagine if I'm your patient in front of you, right? And I'm just taking something, maybe paracetamol, let's say I'm taking for a fever or something today, right? If I'm telling you after taking this medication, my fever will be reduced, does that make more sense to you? Or should I say after taking this pill will go in my body, will kill some, something inside the body to gonna make me feel better, right? So what do you think, which is more like a practical statement? As a patient, I understand why I'm taking that pill, right? So I believe everybody understood now. The answer will be 1. I try to rephrase this question, these options in a different examples So you can understand this question, how we pick up the right answer as well. But those who make this question wrong, that's okay. We have a bunch of questions together today, tomorrow, and future. You will learn always with me together. Just think, as a patient in here, you will understand more why the answer is one, why not number four, right? The right answer is one in this case. And I can see some YouTube students also pick the answer number one as well. So very good. Keep going. Now let's try the next question as well. See if you want to answer the next question too. The next question is, the nurse is assessing a client who recently started taking the Tamsulosin. You never maybe heard which medication is here before, right? See, my purpose today not to share the knowledge. My purpose today to make something simplify for you, how to think common sense, how to find out the answer, even if you don't know the medication in there, right? So if my patient recently start taking a medication, right? And which of the following patient statement, client statement require follow-up? Follow-up means maybe patient don't know much about it, or patient know little bit about it but still need to know something further, and you think as a nurse I need to go there and I need to tell more something about this information, right? So the first one I have is, since I started taking this medication, my nose has felt really congested. Imagine I'm a patient here right now, everyone, right? Imagine I'm a patient right now, right? And I just start taking recently a new medicine, right? They gave you a name of this, right? And if I'm telling you like after taking a medication, my nose getting really congested, stuffy, I think that's okay. It's normal, maybe for some of the patients. I don't think so anything wrong in there. You need to come to see me as a nurse and give me more information about it, right? I think this is something I don't need it because I have to look for something, a wrong statement kind of thing. Now, during the sexual activity, I noticed I did not ejaculate, and then my urine was cloudy. Okay, well, if you did not ejaculate and then urine was cloudy after, maybe that could be normal or not normal. I don't know, urine was cloudy, why it was cloudy, right? But it could be maybe normal for some people after taking a pill, the urine can be changed a little bit, right? I don't know about that. Hold on. Now you compare between 2 and 3. The 3 says if a medication causes impotence, can take an erectile dysfunction medication. Okay, it's already impotence. Do you think it's still a good idea to take the further erectile dysfunction medication if it's already impotence? You don't know about number 2, but you know for sure about for number 3 as a nurse that this is not a good idea if the patient is thinking in that way. I think I need to go there and give more information about this one to my client. So my client knows about it, that they need to take it or not need to take it. They have to talk to the doctor first about it or what to do, you know? So this is my understanding. I'll go there as a nurse by myself, right? Now you compare between 3 and 4 because I hold the option number 3. I have to drop number 2 because you can only keep one before you go to the next, right? Now you compare between 3 and 4. The 4 says, this medication makes me dizzy when I stand up too quickly. I think that's normal. When you stand up too quickly, too fast, you can be dizzy. So you try to stand slowly. That's a good idea, not a bad idea, right? So I think so far for me, the right answer is number 3. Now let me see what everybody picked the answer here now. Okay, I can see some students pick 3 as a right answer. Okay, 1 right answer as well. Some students that pick the right answer too. So when you say 1, Manpreet, ask yourself, getting nose congested, is that something concern for you as a nurse? You want to go there and make a correct something further? Like, what's wrong in there? This is something you want to ask yourself, right? And same thing when you say Preci number 2, right? Why not number 3? What do you think then? If you want to go for number 2, are you okay to, tell the patient, okay, you can take this medication further if you're still impotent? So does that mean you don't want to go to number 3 like that way? You always compare it. Okay, 2 is the correct answer because it's an emergency for the client earlier. Earlier, the correct is number 2. I think, Sammy, you're trying to answering this question or the previous one? This is what I'm confused now. And then some people, they pick up number 4, 4, 4. That's normal, feeling dizzy, because the blood pressure vital signs can be changed after taking a pill. And they're feeling dizzy because it's standing up too quickly. That's why. So I'm not concerned about number 4. Okay, very good. Okay, Rupinder picked the answer number 3. Francis picked the answer number 2. Okay. I have to go back again, Sammy, on the top maybe to see what did you write it down. And I can see the YouTube students also, they're participating and they pick the answer number 3. So when you say, Sammy, you want to pick the answer number 2, doesn't mean that you're going to ignore your patient, for the answer number 3. Are you going to allow this patient to take another medication, even if they're impotence, right? Like this is erectile dysfunction medication. It's already impotence there, right? Are you going to make the things worse further if you allow them to do it? Or do you think it's okay to take it? Or they should have to go and see the doctor first, This is something you want to think about it. So don't get into just trap everyone with the word cloudy. You think what's more urgent for you as a nurse to go in there and you want to make correct more about it because you think you want to go there by yourself as an RN if you're writing exam as an RN, right? Let's see here. Sammy has a bit confusion here. So I need to bring the Sammy here now. Let's see here if I can give you the mic, Sammy. Maybe you can tell me what's the confusion look like. Maybe I want to give you the mic, or if you want to type, maybe that will be great too. Or do you need a mic still? Let me know. Like, what's the confusion? Maybe you can type up for me too. But where does it say is mentally unstable? Does it say in the question? I don't see in there that word, the one you said in the comment, sexualized dysfunction is making mentally unstable. It doesn't say in here mentally unstable. I don't see that word. So that means you are thinking further about it, right? But it doesn't say in here. That's the assumption. But it's not in here. You only stick to the one what says in the question, no? And Muhammad says that's wrong. Okay, maybe Muhammad, you want to help Sammy maybe to clarify this question a little bit for me? Okay. Okay, I'm checking some comments, guys, at the same time. Okay, yeah, no worries, Sammy. You can also send me maybe a private message if you want after the class, and I'll address this question for you. Okay? Yeah, perfect. I hope everybody's clear, the other students, with the answer number 3. 3 is the final answer for this question, right? Anytime, any doubts, you can always bring your doubts together with me, okay? Because remember, we're not gonna like cram any information in here. It just still need to make sense, So that is the purpose of using strategies at the same time. Now let's try this next question, everyone. See if you know about this medication or not, or how to handle this question together. Again, I can see this one of the patient here receiving prescribed Nitrofurantoin. Maybe you don't know about this medication, or maybe if you know, you can solve based upon the knowledge. But if you don't know, you never heard this medication name before, how to handle this question now? And again, I have to find out correct understanding of the teaching. How should I know now my patient know about this medication, the one they're taking it right now? Same method, everyone. Try the same technique with me. The first one says, when urination is no longer painful, I know it's the time to stop the medication. Can the patient stop the medication by himself? I need to explain here to the patient, to contact the physician about it if no longer painful, right? That is not something a correct understanding statement. I need to find out the right answer here. Then we have the second one. Muscle weakness is a common benign side effect from taking this medication. Muscle weakness. Do you think as a patient, okay, well, my patient might can say muscle weakness is a common side effect, but what do you think about this term? Do you think the patient can say this? Does the patient really know it's a benign side effect? Right? I'm doubted a little bit about it. So if I don't know about it, question mark, Now you compare between 2 and 3. See which one is better as compared to the other. If I start to develop a cough as a patient, I should immediately call my healthcare provider. Ask yourself, if someone's starting a new medication and they are getting cough now, right? They are getting the cough now after starting the new medication. Is this something normal, abnormal? Does the patient has to tell somebody right away why there's a cough after taking a medication? What's wrong in there? I think between 2 and 3, I'll pick the answer number 3. Why not number 2? I'm not convincing as a benign side effect. What's this? Benign side effect. Something I never heard of it. I'm not going to pick up that option for sure. Being as a nurse or as a student, if I'm writing down this exam. But something I know, I would be like, yeah, if something happening, they should call the doctor now, right? And it's a good idea. They're doing call right away for this thing, right? Seems like medication not working for this person, right? And the last option I have here is I should take this medication on empty stomach to improve its effectiveness, right? Now between 3 and 4, which one sounds more good to you? More good, right? If something happened, you call the doctor right away, or do you think empty stomach? This medication probably required to take empty stomach. Very rare meds in the world need to take empty stomach. Not all the meds in the world, right? For me, the chances will be more answer number 3. I will be like, why coughing is there? If coughing is there, is the medication something sounds like not working good for this patient body? They need to report to the doctor, right? So I would pick the answer number 3 here rather than the answer number 4 here, right? Something sounds abnormal to me. Seems like it doesn't suit even the body, right? Rarely take on an empty stomach. Perfect. Yeah. New symptom. Yeah. Could be an allergic reaction. Very good. Manpreet. Yeah. It could be an allergic reaction. I don't know. But I think it's a good idea to call the doctor right away. So 3 sounds to me like 100%. The patient knows what to do in that situation. And sounds like 10% chances right answer. Why 10% chances? Because very rare meds in the world on the empty stomach. So if I already have a solid answer in front of me, why would I go with the empty stomach then, right? Which I never maybe read before in the book before the exam, right? So 3 is the final answer for this question. I hope everyone's still with me. You're enjoying these questions. You're learning something out of it. Anytime, any doubts, any question, always come forward so I can always help you in there, right? Now, let's see the next one. The next question we have here is this one. Oh, I can see a question here. Hold on. There's a question on the screen now. Somebody asking me a question. Ma'am, but we are talking about UTI. Then why the answer is like a cough, right? Okay, because we are talking about the medication, not about the UTI. Very good answer, Manpreet, right? So the person who asked me this question, what about if I change this UTI, right? And let's say I mention here something, the nurse has taught a client, who is admitted in the medical surgical unit today and receiving this medication. What about if I don't give you this UTI? My answer will be still same, right? So this is how the NCLEX question could be rephrased, but you should really know the question is not about the diagnosis. The question is about the medication. And always remember, everyone, the keyword is always before the last line. So if this is my last line of the question, before than that, I can only see the keyword is the name of the medication, right? So I hope this is going to help someone who asked me this type of question right now. I go to the back screen because I want to clear your doubt at the same time, right? Now let's see the next question, everyone. The next question on the screen here. The nurse is preparing here to administer. Again, they give you a name of the medicine, right? And it's a nasal spray, something to a client. Okay, I find a word like a nasal spray. So I'm only going to think as a common sense about the nasal spray. I don't know about this medication yet, right? But the question is, which of the following will be a contraindication? Contraindication means big no, right? To administer the medication. Something, a situation. I can see some symptoms here in the answer keys. Where is big no for the nasal spray, right? Now, for this type of question, what do I always suggest the students? In this type of question, maybe elimination also works, but at the same time, I usually recommend look all the options together in this type of question, because usually these type of question make tricky sometime for majority of the students, and then they don't know how to find out the answer, right? So in this type of question, you look at the first, in this method, like the polyuria means lot of urine, high blood pressure, nasal congestion, and there's a lot of productive cough, or maybe just normal productive cough. But then nasal spray, where you give nasal spray? In the nose, right? Then you ask yourself, when you're giving nasal spray to someone, in which condition no for the nasal spray? This is how you want to think about this question, right? I want to see your answer first because it's a kind of easy to moderate level question too at the same time, right? But then I'll tell you my answer for this question at the same time. Okay. I can see some students that pick the answer number 2, some pick the answer number 4, some 3. Okay, very good. Very good. Keep going. Perfect. Okay. Some answers are 3, 3, 3, 4, 4, 4, 2. I would say the answer for this question is number 2. You ask yourself, like nasal spray, why not when someone is urinating a lot? You can give it. I don't think so anything in there. Like, let's imagine if I'm peeing a lot right now, do you think I cannot have a nasal spray for that? No, I don't think so. Does it make any sense to me, right? But what about if I have a high blood pressure right now already, and you're already doing a nasal spray to me? Does it can affect somewhere in the circulation? Think about dilation, constriction, something, that kind of thing, maybe, behind the nasal spray. And then think about high blood pressure is already there. I want to hold on this option, even if you have a less knowledge about it, right? Then, if my nasal is congested already, oh yeah, that's why maybe I'm giving the nasal spray in there. I don't think so. That is a problem, right? Because if I'm putting a nasal spray, that probably might gonna open up, right? So I don't think so. It's a bad idea. So we can give it, right? Productive cough when someone already having some sputum type of cough is in there, right? Think about lungs in that case, and then you think about nasal spray, right? Now you go between 2 and 4, and you see which one is more closer to your answer to the nasal spray. Only think about nasal spray because you don't know about the name of the medication. I give you a big clue about in the number 2 as well. So hopefully some students can find out the answer. Perfect. It increases the circulation. Yes, very good, Rupinder. How come it increases the circulation? Can you let me know more about it? Yeah, and Tracy, can you also type why the answer number 2 you want to pick up? And real me, I can see here, I don't know your name, sorry, but I can see you pick the answer number 2, RC. And I don't know the other name as well. It's just it sounds like it's a different name in here. Yeah, very good, Manpreet, because this medicine increases the blood pressure and of the client having the already blood pressure, and it can do the hypertensive crisis. Very good. It always shrink the swell in the blood vessels, therefore the hypertension is correct. Very good. Because inhaler usually increase the circulation. Very good. These are the explanations. I think the students already know now what it is, right? Good. The right answer is number 2 for this question, not the number 4, right? I don't think so any relation with the productive cough here now, right? So in 2 cases, if someone already has a high blood pressure in here, I think we need to stop giving the nasal spray in that case, right? So see, this is how you look into this question now as well, and you find out the answer, right? I hope YouTube students also learning at the same time now, right? Okay, yeah, if you do have a good knowledge, you keep that definitely. But if no, this is how the style, look at the bouncer question if you have this in your exam. Let's see another question now. I can see in this question some medication names now. Wow, how to do this type of question, everyone, with the less knowledge or no knowledge. It say the nurse is caring for postpartum client who delivered the 2 hours ago and has been experiencing heavy vaginal bleeding and eclamptic seizure as well. Had an eclamptic seizure, okay? So these are my keywords, right? Because this is before the last line, like experiencing heavy vaginal bleeding and eclamptic seizures. Now the mainly question is, which of the following prescription by the doctor should the nurse question, right? Question means you think something, I don't want to give that medication in here. I think we need to talk and clarify with the doctor first. I don't want to give that medication maybe in here. What's wrong? Why I'm giving that medication in here. So when you have this type of question, everyone, you have 4 medications in the option. You know what I recommended in there? Don't go maybe from number 1, right? What you need to do is use here elimination method, right? Now, how you want to use here elimination method is pick that medication first, which you know for sure this cannot be the right answer. Like I can give this medication here easily because the heavy bleeding is happening and because you think the eclamptic seizure also had it before and you think I can easily give this medication. I don't want to pick that as a right answer, right? So that answer, you want to eliminate it first in this case, right? Now, I will eliminate, which one? Oxytocin. Because you might probably also go to my maternity lectures also. And you are like, you read about oxytocin and you know it's induction of labor and also stop the bleeding in postpartum hemorrhage as well, right? So if you know that little bit part in there, you know the bleeding is happening, you want to stop it down. So it's better to take out the option number 1 because you can give it, right? Now you want to think about between 2, 3, and 4. I'll think about the number 3 as a next, sorry. Why I want to 3 as a next? Because you probably also read with me about the magnesium sulfate also, right? And then you think about, can you give magnesium sulfate here or not, right? Because you might know that we want to give in case of eclampsia also. It's a CNS depressant, right? I think I can give this medication to, you have a 2, 3 different like even 2-3 words to remember from my previous lecture from maternity, right? Those students who have not watched my maternity lectures yet, they may be very new to my platform. Maybe you can go later in your free time, go to playlist, watch those lectures. You can ask me doubts, questions, whatever you have, right? So 1 and 3, I will eliminate it right away. Now you think between 2 and 4, which one you think you want to eliminate it next, right? I would eliminate the option number 4, but it's a 50-50. Let's say you don't have a knowledge. Now you're 50-50 between 2 and 4 in the exam, right? And you pick either one. You still have a chances 50-50 to make it correct, right? But if you remember, carboprost is also the uterotonic medication, right? It can also induce the uterine contractions also. It can also probably help in bleeding also as well to control. Then I'm going to delete this medication, and my final answer left over, which I never heard maybe before. This is my final answer to ask the doctor here. But for your knowledge, I can tell you basically this medication does vasoconstriction, and it actually worsens the blood pressure more in there in this client, right? So I don't want that in here. That is why I need to contact the physician here. But as I said, in the exam, at least you can eliminate 1 and 3, and then you play between 2 and 4. Still 50-50, you can find out the answer, in this method, in this strategy, right? See, I did not use much knowledge yet. Still, I try my best to find out the answer number 2. If you eliminate, this way, maybe you will still reach there, right? Now, let me see some questions, some doubts. Everything is in here. Rupinder is asking, ma'am, if we don't have the knowledge, then can we pick the correct answer or not? Like Rupinder, for this question, as I said, if no knowledge, well, first of all, you should have a knowledge for sure, oxytocin and magnesium sulfate, because these are the must-know drugs for the exam, which I already covered up before earlier, if you remember my previous lectures. But if you don't know, I highly recommend if you're going for NCLEX, you should know oxytocin and magnesium sulfate for sure, right? And when you eliminate them, you will be stuck between 2 and 4, where you can play 50-50, right? And Jean, who pick up the answer number 3, highly recommend, even some other students who pick up the answer number 3, maybe, recommend them to go and read about this drug for sure, because 1 and 3 are very common in the NCLEX. You really want to read about this medication for sure, right? And someone is already sharing the knowledge, Muhammad, that number 2 option makes the blood pressure go up very high. Very good. The patient already has severe blood pressure problem from the eclamptic seizure. Very good. So 2 is the right answer. And the next one I can see here, Sammy, also explanation, very good. Some students, they pick the answer number 2. Very good. Those students who pick the answer number 1 and 3, again recommending them, you might need to read about them for sure, because these are those medications you don't want to miss for any single competitive exam. They are very, very commonly testing in there. Okay. Now, I hope everybody got the idea a little bit, like 50-50 still, how to find out this type of question, right? Now let's try another question on my screen. The more we practice together, the more we're gonna learn today, right? The next question I have is related to the nurse is observing a staff member providing education to client who prescribe this medicine. You don't know about this one, but they already give you a clue. Progesterone only form of oral contraception. They already give you a clue here, right? Now, which of the following statement by the staff member, maybe on the floor, another staff member is doing something, and you want to go there as a nurse to intervene because you're thinking something is wrong maybe happening, or this person is not doing good something right now, let me go in there, intervene the situation, and let me try my best to help, right? So use again a little bit common sense. You will find out the answer for sure. Okay. The number 1 says medicine should be taken at the same time every day. Well, I think any medicine in the world, if you try to take them same time every day, it's a good idea. It's not a bad idea. So I'm not going to intervene in there. If she's teaching something like this, maybe to the patient today, it is normal to experience breakthrough bleeding between the periods. Well, for some students, maybe they don't know this, but majority of the students, the women's maybe can correlate pretty easily that between the periods, sometimes bleeding can be started. So yeah, this is normal for some women's, right? So I don't think so. This could be a part of for intervene in there and try to educate this person, right? If you miss a dose, take it immediately, okay? And use another one for 4 days, for 2 days, sorry. Another one for 2 days. I'm doubted as a nurse. Can I say that? Hold on. And then compare between 3 and 4. See which one is a more bad answer, right? Now, the fourth one says you will not need additional birth control. Okay, can I say that as again as a nurse? You will not need any additional birth control while you're taking one of the medicine, since this is the only progesterone. This is only this is the one, right? Now, which one you think is a more kind of that statement, which you cannot say as a nurse, really, right? And that is the answer. You might want to go there and intervene in that case. What do you guys think? More wrong statement between 3 and 4. Try your best, everyone. Then I'll give you the final answer. Very good. Very good. Very good. Yeah, some students initially they pick up 3, I can see. And the last, they pick up the answer number 4. Very good. Let me check on YouTube also. They said 4 is the right answer for them too. Very good. I'll go with number 4 too. I'll go with number 4 too. You know why? How can I say that, you don't need another additional medication? I think better to recommend to go and see the doctor about it. And how can I say while you're taking another medication and this is the only one, the one they give you in the question? No, I don't think so. I can say that. But what about the number 3? If you miss a dosage, I'm just trying to teaching there, you need to take it then. I know you're not still convinced with maybe with number 3. Maybe you're convinced only 50%. Can I say that or not? Like take immediately? But you know what? Sometime in the exams, two statements maybe sounds wrong. So in that case, the tip for all of you is pick that answer which is more on the wrong side, right? Which you think 100% I cannot say that, right? Well, if a patient missed the dosage, of course I need to teach when to take that. But how can I say this? I think they need to consult with the doctor about it, right? So I'll pick the answer number 4 in this case. I hope everyone learning still with me, how I still pick the answer for this question, right? Okay, let's see here. Now, the next one we have here is the next question. This one. Now, maybe some of you already know what is lorazepam, which is sounds sometime easy medication. But why I bring this question today? I bring this question, first of all, this is a SATA question. And then second reason I feel like sometimes with even the easy meds, you know maybe what is lorazepam, but you still don't know how to find out the answer, right? So this is the purpose of this type of question. So which of the following finding indicate the client is experiencing withdrawal symptom? So those students who do not know what is lorazepam, you think in this way, withdrawal symptoms. Withdrawal symptom means not taking a medicine and then withdrawal started, right? Ask yourself, when a patient is not taking a medicine and a withdrawal something effect started, does the body go on the upper side or does the body go on the lower side? Which means, do you think your patient will be lying very quietly in the bed because not taking a pill and that is withdrawal symptom we call? Or do you think your patient will be a lot of like hyper, pretty much on the upper side and that is a withdrawal effect because they don't have that pill right now with them, right? So think on the upper side, lower side first before you look into this question, I would say, right? So let me see here. Manpreet already picked up the right answer. This is what I can see so far. Okay. So think about everyone. Downer,
Upper side, you think the body will go down? Rupinder, when you say down, you want to think about in the form of the withdrawal symptom. Imagine maybe you used to eat one of the food before, imagine, okay? And if I don't give you that food right now, right? How your body gonna act out? Your body gonna start looking for the food, right? So do you think you will be down just sitting on the bed, or you're gonna start look around for the food? What do you think? Right? So this is my question then when you say downer, right? You will find out the answer right away. Okay. Let's see here. Some answers I can see here now. Very good. So let's try this question, everyone. So the first one says runny nose. Runny nose, withdrawal symptom. I don't think so. That could be there, like runny noses in there. That could have been possible in any case, runny nose, right? I don't think so. This is specific for the withdrawal symptom related. So I'm not gonna go look into the the runny nose right away. Shaky hands. Yeah, probably because your body is shaking and looking for it and craving for it. You know, you want to look around it, right? So shaky hands, I want to put it in, and your muscles start twitching at the same time. I want to keep it in too because it's the upper symptom, right? Not a depressed, it will be more euphoria kind of thing, more hyper kind of behavior I'm looking around. I'm not looking the low blood pressure, I'm looking maybe high blood pressure in that case. Yeah, your body is like fidgeting and difficult sitting still. You can't sit in one place because you're looking for that stuff around it, right? So far I can see 2, I can see 3, and I can see 6, right? Only average 4 hours of sleep. You can hardly sleep. You're so restless. You're looking for around it, right? Your body is on the upper side right now, right? So I would say the final answer for this question is number 2, number 3, number 6, and number 7 in this case, right? I hope everyone is learning still how we handle this type of question. For the knowledge part, who wants to know what is lorazepam? This is your benzodiazepine, right? You should know lorazepam for sure for your exam, but if you forget, this is how you want to do the question like in this way, right? Now let me see if any particular doubt which I need to address in this one. Because it's depressed. In this case, the question is by the Muhammad, right? You said why not the option number 4 in this case, right? So instead of like the depressed, I would say this person is the more will be in the restless, like a more on the upper side, you know? So not like a depressed kind of behavior. I would look for more CNS stimulation, like not the CNS stimulation, sorry. What I want to say is the depressed effect you want to find more when someone is withdrawing, especially from amphetamines, like from stimulant. This is what I want to say. But here I want to see on the upper side kind of symptom, like a more kind of withdrawal with the restless, anxiety, fidgeting, you know, that kind of behavior you want to look into this case, right? So I hope everybody understand this question, right? If there is any further doubts in here, you can always ask me as well. YouTube students, I'm watching your comments. Continue commenting it, and you can always ask me doubts and questions so I can address at the same time. Let's try the next question, everyone, so we can see this one as well. The next question, even if you don't know what is chlorpromazine, how we can find out the answer? When evaluating the client for life-threatening, you want to see something life-threatening related to a medicine, and the first thing to report. You might have to report everything in here. But what do you guys think? Emergency, you can't wait. I have to tell that thing first right away. I think this is an easy question. Do you think someone can die with a urinary retention? Someone can die with a dizziness? Widespread muscle rigidity, or acute spasm only in one location, which is face, right? Don't get trapped with the words acute. You really want to use your common sense. This is only one place, and this is all over, right? Ask yourself which symptom you think cannot wait. and I need to tell that symptom right away. What do you guys think? Okay, I can see 333. Okay. It doesn't really say about the airway here, Manpreet. That's the overassumption. Okay. It's only talk about muscle spasm only on the face. Okay, perfect. YouTube students, what do you guys think? Which answer you want to pick up? A lot of students must be confused between 3 and 4. Perfect. I can see 333. Perfect. The right answer is number 3, everyone. See? Did we read about the chlorpromazine? Not yet. But this is how you think about this question. You have 4 symptoms in front of you. Think about which symptom is something you can't wait and you have to tell right away, right? There you go. The right answer is number 3. Those who are still thinking about the airway, I want to let them know it's a muscle spasm on the face. They don't tell you anything in your throat or anything about airway related in here. That's the overassumption further, right? So think about in that way and don't get trapped all the time in acute chronic words as well. You see something happening right now and why this is spreading a lot all over the body, right? So this is something you want to think as well, what it can lead further. You will find out the answer, right? So the right answer is number 3 for this question. Let's try another few more questions with me. We still have a more questions today, right? Now, a nurse is assessing a client who recently started taking Alprazolam. Maybe you know what is Alprazolam, but if you don't know, this is how you should solve the question. It says as needed, and they already give you word, panic attack. So they already give you something why you want to give Alprazolam to someone. And they said, which of the following client statement is most concerning? Most means something, you want to look in there right away. That cannot wait. Something I have to jump into there right away, like you have to pick up that something, that statement to tell the doctor immediately. Again, something look a serious kind of statement in here. Very good, right? You're almost there, everyone. You can do this question. Try your best. Ask yourself, when a patient says, I have a history of this, is this something concern for you? Not right away. That can wait, right? Eating disorder. After I take the alprazolam, I can't stay awake. Sleeping issue. I don't know. Hold on. But not an emergency, sounds like, right? My psychiatrist just started me on this medication for my anxiety. Now, which one you want us to keep, number 2 or number 3, before you go for number 4? My psychiatrist just started me on sertraline. Okay, you think about your antidepressants and everything from an anxiety. Okay, well, for me, 2 and 3 pretty much similar, right? I'll keep only one of them and I'll read the option number 4 first. The 4 says, my dentist just prescribed hydrocodone for a procedure I had done. My dentist just prescribed. Is this something I have to tell doctor right away? Is this something I have to tell doctor right away that can't wait? And is this something emergency I have to tell them that the patient can't sleep, right? Which is a more emergency kind of statement, you think. I have to go there and tell the physician right away because it says most concerning for me. And I have to, once I hear that statement, run to the nursing station and tell my doctor right away about it, right? So what do you guys think now? There you go. So when you say 3, Gurpinder, you say 3, right? Why not the number 4? Ask yourself, Gurpinder, does that mean when the dentist give you any medication, the patient can just take it? What do you guys think? Or you're not going to consult with the doctor on the floor and see if that's required or not? What do you guys think now? This is how you think about this question. Who says the answer number 3? I can see Jean, Real Me, Tracy, Francis, other students, whoever picked the answer number 3. This is how you compare between 3 and 4. Very good. Ask yourself, which one cannot wait? Which one cannot wait? I want to go into there and tell them right away about it. I'll pick the option number 4 as a final answer. You know why I picked the option number 4 as a final answer, right? Why the option number 4 as a final answer? Because if you want to use your knowledge part, you can use your knowledge part too, like hydrocodone, opioids cannot take together, right? Maybe something you want to think about those kind of things in here, like a severe sedation happened from the hydrocodones, right? And the alprazolam, definitely it's a CNS depressant also at the same time, right? So if you want to use your knowledge part, you can use your knowledge part also. But if you don't want to use your knowledge part, you want to think of common sense. Then the common sense, I will be like, dentist give this medication, you know? Do I have to tell somebody about it? Like patient is already taking a medication which makes the body down for panic attack, and this is also going to make down. Can these two meds taken together, or should I tell the doctor about it? This is how I will think about this question, and I'll pick the answer number 4 in that case, right? I hope everyone's still learning with me how I pick the answer for this question. The final answer will be number 4. The one you said, the number 3, that is definitely your antidepressant SSRI, right? Well, you can definitely educate the patient here. When you take this medication, it can does the drowsiness and everything, but not a severe sedation gonna happen for this one. But if you take number 4 together with the alprazolam, severe sedation can be happen, which is dangerous. So I want to pick the answer number 4 in this case, right? I hope everyone's still learning with me so far. You guys are still here. No boring class, right? It's still interesting. No interesting. Type anything for me so I know you guys are still awake. Students joining right now from Ontario, US students, I know it's almost 2 o'clock on your end. Only few more questions. Just bear with me so you can learn something out of it today. Okay? Now, the next one we have at this question here. You guys see this one? What medicine is this? If you know phytamine, what is that? It's a good idea. But if you don't know what is phytamine, what kind of medicine is this? How do we solve this question now, right? Which of the following client statement, maybe patient statement, indicate the nurse to you that the medication has been effective? How would you know the medicine has been effective? And only pick that answer which you know as a nurse. Something you don't know as a nurse, you don't want to play with it, right? Because this is a SATA question, right? And in SATA question, always pick that answer which you know, otherwise you're going to lose the marks. This is something I want to tell you guys, but I'll tell you more about this one tomorrow when you come to my SATA classes at this time, okay? So the first option says, I may experience low blood pressure on this medication. I will ask myself, I know may is a good idea, but you know what? A medicine name which I don't know, I don't know this medication does low blood pressure or high blood pressure, right? This is I'm like a doubted. Can I pick this one or not without knowledge, right? And then you have the second one is, it is important that I try to take this medication in the morning. Good idea. It doesn't really say early in the morning, empty stomach or whatever. It just say morning time, not a night time. Sounds a good idea to me. So I'll keep it in. Number 2 so far, right? And then I might be more tired on this medication. Again, it's something medication which you don't know what it is. In that case, how would I know the patient get more tired after taking medication or more energetic? I don't know about it. I'm doubted. And the fourth one says, I should monitor my mood. I think monitoring mood is a good idea, but what does it say next? As this medication may cause suicidal thoughts. Again, ask yourself, right? Why does it say suicidal thoughts? You think about your mental health meds where you read about suicidal thoughts. You don't know about this medication does suicidal thoughts or not. Better not to pick. because you never read about it maybe, right? You maybe know societal thought medications already, which one they does when you read about the mental health medications, but maybe you never heard this medication, Vitamin, it's better not to play, right? Because societal thoughts definitely sounds like your mood and behavior is changing now. You sounds like more on the depression side, right? That's why societal thoughts maybe, right? And this is also lower kind of, the first one I can see also lower kind of thing as well. 3 also low, right? So this is my another strategy here, guys. So if you not picking up 1 and 3, better not to pick 4. But if you pick 1 and 3, yes, then pick 4 for sure, because they all are same together, right? They're all on the lower side, right? And the fifth one says, I may not get hungry. I think every medication in the world, usually everybody know nausea, vomitings, right? Okay, good idea while taking this medication. So I need to set the alarms. Good idea. Nothing wrong in that to setting an alarm because you're not getting hungry, maybe, right? So far, which I know without knowing the medication, I picked the answer number 2 and 5 as a final answer for this question, right? Something you don't know, better not to play, because you don't know does increase or decrease the blood pressure. You don't know does it make you more tired or energetic. You don't know suicidal thoughts or not, because you don't know what medication is that, right? So better not to play when something you don't know, right? Definitely, it's a stimulant, just so you know, as a part of knowledge. But if you don't know vitamin is a what, stimulant or depressants or whatever, then better not to play, right? So the final answer for this question will be 2 and 5, right? Now let me see here. Okay, yeah, that's fine. If someone typed the option number 6, that's okay. Yeah, so the answer is 2 and 5 for this question. Okay, let me see the YouTube students also, if there is any doubt, any question in there. I don't see any doubts question so far yet. Now let's go to the next question today. Now, this is something you can see here. They give you lab results this time. Sounds like a case study type of question, no? Right? Now, they give you like a lab results, and then when you read the question, right? The question says the nurse is caring for a client diagnosed with a schizophrenia, right? Who is prescribed olanzapine. Okay, if you know olanzapine, it's a good idea because it's one of the important drug for your exam to remember. But if you don't know, that's okay, right? So this is how you should look into this question. Again, most concerning. Maybe everything is concerned here. Something you think that cannot wait. I have to tell somebody right away, right? So when I see the 4 options here, this is how I'm gonna look without doing the elimination process. First, I will be like BMI, then hemoglobin A1C, then they give you some triglyceride, they give you WBC. So once you see the question like this, then you look at the options, the table, sorry, they give you on the top, right? So when you see the table, they give you BMI, right? So when you see the BMI, I can see it's higher, overweight. Ask yourself, somebody can die with the overweight right away? I don't think so. That can wait, right? Now they give you like hemoglobin A1C 6.3%. It's a little bit on the higher side, but not something which gonna make someone die right away, right? So that can wait, right? Now you go between 3 and 4. So those who pick the answer number 3 and some pick the answer number 4, think back again for me in this question, okay? You want to think in the form of the cholesterol something, right? Or you want to think in the form of the infection something, right? Because WBC, if it's reduced here, you can see it's reduced now. You want to think about infection. And number 3, you want to think in the form of cholesterols maybe, right? It's a little bit higher. I can see that 220, right? Until 160 is normal, right? But then ask yourself, which makes the person die first right away?
Do you think 3 will make the person die right away or 4 will make the die right? It's like a more concerning infection that can make a person die. So which one you want to pick first? Infection can be treated first and then we'll treat number 3 later, or should we treat 3 first? Infection can wait. You know the answer now. Very good, everyone. The 4 is the right answer. Think about the infection. Okay, so what I want to highlight it here now, I know it's a part of knowledge also. Someone share here the 4 is expected agranulocytosis adverse effect of the olanzapine. But I also want to tell you guys, what if they change the name of the medication here? They change the diagnose here for you guys too. Still find the answer number 4 because infection is always concerned, right? And that cannot wait in someone, right? So this is how you look at the question now. Now you go to the next question again with me. See how you want to handle this question too. It says, give me 1 second. Okay. Yeah. So now the next question I have with me is the nurse is caring for a client for 48-year-old with a chronic low back pain who was recently started on 1 to 2 tablets of this one, right? And this sounds like a keyword. They already mentioned you this medication is for pain, and this is as needed PRN medication every 4 hours, right? And then they wants to know most and also immediate and also follow up, everyone. So look at here very carefully, everyone. 3 keywords in your question. You have most something cannot wait, immediate, emergency, cannot wait. Follow-up means bad, cannot wait. I have to go there right away, you know? So look for that statement which sounds dangerous to you. Oh my God, why is it there? Let's go right away in there. That cannot wait, right? The first one says, this medication make me feel drowsy, so I try not to take too early in the day. That's not an emergency for me. I have only bowel movement every 3 to 4 days since I start taking this medication. Well, constipation could be normal, but that's not going to make someone die in here. So that can wait, right? So Francis, who picked the answer number 2, ask yourself, do you think someone can die with a constipation? Right? This is how you want to think about it. And also ask yourself, is this expected with this medication or not? Right? Now the number 3 is, I think I'm coming down with a cold. So my wife brought home plenty of cold medicine. Why? Why plenty of cold medicine? Why? I want to think about this one too, right? So now this is how you think about this question, right? Like why this is a plenty of medication now? I have a couple of beers each week. Okay, I'm not concerned that, but not usually taking when I'm taking this medication. Okay, patient knows that. The patient cannot drink at that time, right? But what do you guys think for the option number 3? The family member brings, and it's a plenty of cold medication. They bring it, right? And the patient is already taking one of the pill at home as needed for pain. So first of all, without knowledge, you should be asking yourself, if the family member bring lots of cold medication in the house, can the patient take all those meds by himself or herself, or the patient needs to consult with a doctor? This is the first thing you want to think. Now, the second thing you want to think in this case also, like you think about the cold medication include mostly what ingredient? Acetaminophen usually, right? So do you think if the patient already taking acetaminophen in there, can patient take another acetaminophen in the home because family is bringing the cold medications? This is how you think about this question, everyone. And then you find the answer finally is the answer number 3 for this question. I hope everyone is still learning with me now. Let's try this question, everyone, right? Just a little bit reminder back again, if in case my baby start crying, I have to leave the room for 5-10 minutes, but you do this question for me until I come back, okay? Just give me a minute. I'll be back, everyone. Hi, everyone. I'm so sorry I'm back. I hope everyone can still hear me and you guys are still here. Sorry for the delay. I actually have almost 20-month-old now son. So as I said earlier, sometime he don't want to sleep alone. So that's why he always crying sometimes, at this time. So I have to leave the room, right? Okay, so I hope my voice is audible now. Everyone can still hear me. I'm still here. I really, really apologize for the delay. Okay. Now let's go back to here again. Very few questions left, right? Those who write it down on my screen, ma'am, not here. Okay, well, thanks for that. But I already let everybody know. Maybe just use your chat boxes every time, not to draw anything on the screen. Okay, I highly, highly recommend not to draw anything on the screen next time. Okay. Now, I will be very quick in next few questions. And just in case, just so you all know, if my son gets up again and I'm not able to finish the session today, then I'll give you all these presentation in your WhatsApp group so you can do some other questions too and let discuss all everything over together there with me as well. But I'll try my best to still finish the presentation as it's only few questions left. Okay. So this question, I can see it's related to allopurinol and it's a gout related question, right? Maybe you don't know what is allopurinol. Let's see how to handle this question, right? But the first thing I want to say, you really need to read about this medication, one of the very commonly tested in the exam, especially someone who are writing down this month and next month. You really wants to know about this medication for the exam purpose, but in case you don't know how still to find out the answer, right? So the first one says, so this is a SATA question. So I will definitely use the good idea, bad idea kind of style in here and see which answer is something I feel 100% and I want to keep it in, right? You can also use your chat boxes at the same time. So I know that which answer do you think and why, right? So the first one says, I need to drink 3 liters of fluid daily. I would just think in a generally drinking of lots of fluids is a good idea or is it a bad idea? This is how I will think about it, right? So for me, this is a good idea. This is not a bad idea, drinking a lot of fluids actually by someone, right? So the first one, I would like to keep it in. The next one we have is I will take this medication with meals. Okay. Good idea, bad idea, because most of the meds they do GI upset. So this is how you want to think. I will be like, probably is a good idea. So I want to keep it in. And the next one we have is I can take this medication with the ibuprofen. Now, this is something a bouncer kind of statement, which a lot of students maybe they don't know, can I take this medication with ibuprofen or not? For those students who don't know, better not to play this option because you don't want to lose your scores in case this is a wrong answer, right? But for those students who have a good knowledge and they know you can take with the ibuprofen, then only you pick up the answer number 3, right? For me, I'll pick this as a part of the knowledge answer, but just in case who do not know about this one, can you take with the ibuprofen or not? For them, I highly recommend not to play with the option number 3, just for the safer side because you don't want to lose the marks. Now, the fourth one says a rash is a temporarily expected side effect. Do you think a rash is temporarily and it's expected side effect? I will be like, no, I'm not expecting, and that sounds like adverse effect. That's not temporarily. I will take it away. I'm not gonna keep it in. Bad idea. Then the fifth one we have is I will take this medication if my gout flares up. Okay. If my gout flares up, I will take this medication. Or should I tell the patient, I think you should consult with the doctor if it flares up. you might need to change medication or take a same or take an extra dosage or what. I will be like 50-50 in this option. So I'm not going to pick up this option again. The next one we have number 6. If I have a diarrhea, I will stop taking this medication. Like you got something, you will stop medication right away. Can your patient do that? Or do you think your patient needs to consult with a physician about it before stop taking the medication just by him or herself, right? So I will not consider again just because this word. And then the last one we have is I should avoid alcohol. Okay, avoiding alcohol is good. Intake while taking this medication, I think it's a good idea. Nothing bad into this because you're taking a med and you don't want to take alcohol on the top of it. It's a universal point with every single medication in the world. So I would like to keep it in. So for me, the final answers will be 1, 2, 3, and 7. This is how I will go for this question as well. Now, let me see your answer keys as well. I can only see 2, 3 answer keys so far. Where's everybody answers? Try your best to type here. Oh, you already answered earlier. Okay, perfect. I can see now, sorry. I have to go above maybe in your chatting now. Okay, why the option number 3? Yeah, this is for the part of knowledge, Manpreet. As I said, the option number 3, what in my understanding is, it's one of the non-steroidal anti-inflammatory drug, which I think it safely can be given with this medication to handle the pain, actually, which is very worst in a gout patient. So for me, it's a good idea. It's not a bad idea to do it. But as I said, when someone do not know about that part as a knowledge, better not to play third option because you never know if it's a wrong statement. You don't want to lose your score, right? But if you already know, then only play with the option number 3. So I hope everybody got the answers, right? Now, I got a question on the YouTube. They say, if you pick the right and wrong answer, will you be awarded 0 for the question? Okay. So whoever asked me this question on the YouTube, I highly recommend watch my class tomorrow. Why? Because the tomorrow class is actually specifically on select all that apply question. And I will also teach you guys how the scoring will work at the same time using bunch of examples. So you actually understand better in which way the exam score will be 0, 1, 0.5, and so, right? So this is what I recommended for this type of question. Just maybe wait for my session tomorrow. We'll definitely address you this question for sure. Now, let's see the next question, everyone, on the screen without wasting the time if you know this question already now. Now, the next question I can see here is, the nurse has taught a client with the acne. They already tell you the problem, who is receiving newly prescribed. Okay, maybe they tell you problem, but you don't know maybe these meds, right? But you know what is the meaning of topical for sure, right? You don't know what is benzoyl peroxide. You don't know maybe what is retinoin creams, right? You know cream meaning, you know topical meaning, but you don't know these two meds maybe, right? If you know, it's good. If you don't know, this is how you can handle the question in my style. The question says, which of the following statement by the client would require follow-up? Follow-up means bad statement. Something I want to go into there and look into, explain about it more in there. Now, the first option says, I will apply cream. I'm just going to say cream because it's a cream. I will apply the cream at the night time before going to the bed. Nothing wrong if my patient want to apply the cream before going to the bed. I don't think so it's a bad idea or good idea or whatever. I think it's a generally the patient just trying to telling me, I will just apply the cream before I sleep tonight. Nothing bad into this. Definitely can help throughout the night too. So why not, right? So not follow up in this case. The second says applying sunscreen will make the medication less effective. Sounds like a very, very solid statement. Means how the patient can be 100% sure here will make less effective. I have to think about it. Is it really going to be less effective? Or is it going to be still same? Or is it going to be worst? I don't know. Let's compare with the other options, right? Now you compare between 2 and 3, right? The 3 says, my skin will peel and feel dry when taking this medication. Well, I think most of the students, they don't know about the peel, but they know for sure about the dryness. I think everybody know, every nurse know in the world, any cream, any ointments, whenever you're applying on the skin, it can change your skin texture a little bit, right? Make a little bit more on the drier side, probably, right? Especially if it's a medicated cream, right? So I don't think so any bad into this statement, but we can still think about the peel at the same time and comparing between 2 and 3. So between 2 and 3, I still want to keep number 2. Why? Because it's really like a solid statement. The way the patient is said, it sounds like patient is very sure about less effective. So I want to hold this statement for now and compare with the number 4. And when I compare the 2 with the 4 says, if I have a burning redness, I may be applying the cream too often. Yeah, maybe because you're using too often, too quickly, too early, like too close means you're using like again and again. That's why maybe you have a redness and burning. So there's nothing wrong into that, right? So this is like a good statement. Now you go between 2 and 3. If you still want to go back between 3 again, I'm gonna pick the answer number 2 rather than number 3, right? So first of all, it's like a solid statement. I personally thought how the patient can say it's a less effective and so, right? Because usually when someone apply the sunscreen, you want to protect your skin from the sun just from the UV radiation, right? So if someone using sunscreen and topical ointments as well, I don't think so that can be affected at the same time, right? This is per my understanding, right? But if I talk about drying, peeling, I know drying is for sure common side effect. A lot of students, this is how they're gonna think maybe. But if you already know half of the statement is right, probably full statement is right maybe in there, right? So that's why I want to pick the answer number 2, where I want to go and maybe see with my patient and teach my patient that they do not need to stop using sunscreen. They can still use it, teach maybe more about thing in here. And this is how I will be following up. So 2 is the right answer in this case. So most of the students I can see they pick up the answer number 2. Very good. Seems like you know now the strategies how to apply into in here, right? So now you see the next question with me if you are good with this type of question. The next question again, I can see it's a newly prescribed med and you don't know maybe which medicine is this. Again, it's a wrong statement. You want to find it out, right? I think this is an easy question, which a lot of students can do by themselves. So maybe I will let you to take a control on this question, right? And I will just wait for your answers, everyone. Tell me the answer. What do you think now for this question? Very easy question, which you think in generally, this is something I need to go to the patient and maybe ask more question about it. So tell me what the answer do you think between 1, 2, 3, and 4, something like a wrong, like you have to go there as a nurse and maybe educate more about it in there, right? This is how you can find out the answer. Perfect. I can see 1 so far. Very good. Very good, everyone. Keep going. Keep going. Very good. Very good. Yeah, YouTube students, what is your answer for this question? I can see you guys done the previous question. What is your answer for this question? And someone is asking me, will be posting recording of this lecture on the YouTube? Yes, it will be there. Any class, whichever I'm doing online, offline, everything will be available on the YouTube. Remember, guys, this is a free nursing classes initiative, nothing locked for all of you. Everything is open publicly. You can watch anytime, as much as you want, even not just watching recorded lecture. I always tell the students, don't just watch it. Ask me the doubts and questions if you have after watching the class. Because I don't want you to just sit on the recorded videos and just listening by yourself. Maybe just learning by yourself, right? It's better to connect with me if you have any doubts, any question, even after you watch my recordings anytime. So I can always address the doubts for you. Very good, everyone. One is the right answer for this question. I don't think so. I have to tell you guys this question in here. Yeah, in pregnancy, definitely need to look into like why you want to take this new medication in here. So one is the final answer for this question. I don't think so. I have to go back to this question again. Now, let's see if I have a next question in here. The next question is, the nurse is preparing to administer the first dose of this medicine, and they already tell you the keyword here, the name of the condition actually, right? Now, which of the following test results? Now, I find this question a little bit tricky actually, and it's on the difficult side. Why I find it on the difficult side? Because everything sounds good, right? So which one you want to think you want to prioritize first? Like first thing before administering the medication, right? Now, when I see the options, I'm like, everything sounds good. I need to check the liver. I need to check for pregnancy. I need to check for CBCs. I need to check for tuberculosis. You know how I look into this question, then back again, I actually then rethink about it. Then I start looking into which test can wait, which test cannot wait. This is how I think about for this question then, right? Something which is like can wait, something which cannot wait, you know? So then I thought like liver enzymes can wait, you know. If I take a pill, let's say this is a pill, like oral medication, I don't think so it can affect my liver right away, right? Then when I see the urine pregnancy test, okay, pregnancy I want to look into, but you know, when I see the word urine, I will be like, why not the blood test? Why is just the urine test? So I was like a question mark in here in my brain. And when I say CBC, okay, I want to think about CBC, WBC counts, and everything in here, right? Then between 2 and 3, I thought about number 3 rather than number 2. And then when I go between 3 and 4, you know what, guys? I thought about like tuberculosis. They already give me a name of the problem, name of the condition. And why I'm doing screening, this is what I thought, you know, why I'm doing screening. I was like, what if I take this medication and I give this medication in someone and I did not screen the person for TB? I think about immunocompromise, you know, like immune system, um, you know, reactivating of the same problem. If that was a latent condition, maybe active tuberculosis in there, right? Maybe latent, right? From screening test, this is something you want to find out, right? So then I thought about which is something cannot wait, right? And I want to do that test first right away. Which something can wait half an hour, 1 hour, I can do that later on, you know? Then I thought about the answer number 4 in this case. Otherwise, I was like number 3, right? So my final answer is number 4 for this question. This is one of the difficult question I find out for majority of the students. But let me see if you guys handle it really well or not. I'm going to look into your chat box pretty quickly. Yeah. Some students they pick 4, some students they pick 2. So those who pick 2, you think about urine at the same time, right? Blood test is more accurate. Urines are tests are not always accurate. This is something you also wants to know, right? Perfect. So 4 is the final answer for this question. YouTube students, they already pick answer number 4. I can see that. You can always stop me if there is a doubt, any question further in here. I can always address it for you, but this is how I use this kind of strategy and look into this question, right? Now, let's see the next question in here. Now, this is the nurse is teaching a client with the HIV who is beginning the antiretroviral therapy, and they already give you the name of the medicine as well, which information you want to include about it, medication, right? So something like a good statement, and I think it's one of the easy question. You guys can do it by yourself as well, along with me. I will wait for your answers first. Let me know which answer do you think and why, right? Then I'll tell you my answer key for this question. I think it's the easiest question. Don't look at the word, like viral, antiretroviral. Just think it's a new med, right? Somebody starting a new med. And what are you going to teach generally to someone about it, Which is a good statement. Sounds good to you. You think they need to do it for sure, right? So think as a good idea rather than bad idea, right? You will find out the answer right away. And someone on the YouTube, they say, lecture is very interesting, but it's almost 3 o'clock in the morning. Yeah, I'm so sorry. I know for US and my Toronto students it's 3 o'clock, and you say you don't want to leave it, but you have a shift tomorrow. Oh my goodness. Yeah, I really apologize coming late at this time, guys. But you know what? I hope a lot of students can correlate with me. You guys can understand. I teach for free in the middle of the night when my baby goes to bed, right? Just trying my best a lot around the world wherever I can. But you can always watch my recordings later, if something, maybe you want to go to bed now, you have a work tomorrow, those students, you can definitely watch my class later on, right? Now let's see, a lot of students, they pick the answer number 3 here. Very good. Yes, Fallon, answer is 3. You're almost there. Very good. Yeah, if any doubt, any question here, anyone, you can always stop me. You can decrease the dosage of medication. No, you need to contact the doctor if you're sick. Taking this medication on time daily is the best chance you have curing. I will be like curing, right? Contact your doctor immediately if you develop fever, mouth sores. Good idea. That's what they need to do it. It's normal for this medication to make you have like a flu for the first week, between 3 and 4, which is more like a solid statement. Number 3, this is how you find out the answer, right? Almost there, everyone. Let's try this another question with me, probably my last or second last question for today. The nurse is preparing to administer the leucovorin to a client who is undergoing chemotherapy with a high dose of methotrexate. The patient is asking you why I'm taking this medication. So what are you going to reply? Now, one tip I want to give you in this question is pick that answer, that language, everyone, which you think patient can understand. Something patient cannot understand, that is not your right answer. Okay? Whenever we teach something to the patients, you always teach in a simple language. This is something I want to say, even in reality, even in your NCLEX questions. Okay? So delete that answer right away, which patient cannot understand. That will take you to there, right? Now, the first one we have here is, this will stimulate your bone marrow. Do you think your patient can understand that? It's going to stimulate your bone marrow to make WBC. This is something you want to think. The second one says this is given to block the effect of chemo. Makes sense because the patient knows already they're going in chemo, and your patient already know that the bad cells you're killing in the chemo, not the healthy one, right? So I think my patient can understand 2, but my patient cannot understand 1. This will help with the symptoms of nausea, vomiting you're experiencing now between 2 and 3. What do you guys think? Do you think this medication is for nausea, vomiting? Or do you think this is for chemo related for not to kill the healthy cells? I would be like number 2, not the number 3. Now you go between 2 and 4. This lower your blood level of uric acid, which is released from tumor cell. Do you think your patient can understand that? I don't think so. By the time I say release from tumor cells, my patient will be like, what? What is uric acid? Right? Oh, what are you talking about? Released from here and there. I don't understand that part, right? Complicated, too complicated language. So the final answer for this question will be number 2. This is how you can do this type of question. Very, very good. I can see majority of the students that pick the answer number 2 here. You can always stop me if you still have any doubt in this question as well, so I can always help you at the same time. Let's see another last question for today, and I can see this one related to Indomethacin to a pregnant client. I think this is another easy question as well, but one thing which makes me to bring this question here today, because I have noticed everything sounds good, options, everything sounds good. Now, which one answer you want to pick up in here? So think as a first in that case. Why first? When the question doesn't say anything, think first, right? When you think you have a pregnant client in front of you, and your pregnant client, you're about to give a medication in there. You're preparing right now, right? So do you think you want to know the history first, and then you want to think about the calcium gluconate availability on the floor? Or do you think go and check calcium gluconate first and then ask the history later, right? I would be like history first. Asking my client about like what is your weeks of gestation right now before I decide about any medication for them, right? Then I will go on the floor and see, verify if I need it, right? Now, the third one says whole medication if the respiratory rate is 12. Well, this is a part of assessment. I will only do is if I need it before I administer the medication. But before I administer the medication, I think it's a good idea if I take my history first, right? So again, number 2 comes first before number 1 and 3, right? Even if you don't know the 1, 3 can you do that or not, right? The 4 says assess the blood pressure. Again, 3 and 4 is a part of assessment, right? Now here's another strategy, guys. If 2 options are same and they only need a 1 answer from you, none of them can be the right answer. This is a part of assessment. This is a part of assessment. If you're checking blood pressure, why not respiratory rate? If you're checking respiratory rate, why not the blood pressure, right? So I would be like 3 and 4. They both are gone. Now you think between 1 and 2, right? So between 1 and 2, 2 comes before 1. This is how I think about for this question. And I find my final answer is number 2. See, the question language sounds simple. Answer language sounds simple. But when you look at the option, you are like, oh, what comes first, right? So this is how you can think about for this type of question, right? So the final answer for this question is number 2. Well, if you know already as a part of knowledge what is indomethacin, then you can go with that way. But if you do not know about the knowledge about indomethacin, this is how you can look at the question with me, right? I have a question from one of the students from Zoom. They say, Fallon, opposite answer is a good in the standalone question. I think, oh, you're talking about another strategy, Fallon. I got your question now. Opposite statement means, let's say, if this one say respiratory rate less than 12, and if this one says respiratory rate more than 12, right? Then one of them is a right answer, right? That is another different type of strategy. But what I'm trying to say here is this is another different strategy when you have two different statements, but they both are talking about similar kind of things. None of them is the right answer. Because if you do number 3 assessment, why not number 4 assessment, blood pressure first? But if you check blood pressure first, then why not the respiratory rate first? This is what I mean, right? So that is a different strategy for sure, right? I hope you got my point in this case as well. Yeah, no worries. Yeah, I hope everybody learning so far with me. You guys understand all these questions today, what we learn as well. And that's all about the questions for today. Thanks so much for joining. I really, really appreciate it. I hope you find the lecture a little bit interesting. I know, except the part of the break a little bit in between. But tomorrow we have a class on select all that apply. Make sure you do attend these classes for next 10 days. If you really want to pass the NCLEX, doesn't matter, this is your first attempt and you are the repeat test taker. I'm pretty sure you're going to learn in all these 10 days with me. Bring your all the doubts, all the question, whatever you have before the class, during the class, so I can always assist back with you, right? Thank you so much. I don't see any questions so far back in here, so perfect. Thanks so much for joining today. Yeah, no worries, everyone. Yeah. Yep, thanks so much. Yeah.